Welcome to Lyme Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Dr. Todd Maderis is the founder and medical director of Marin Natural Medicine Clinic in the San Francisco Bay Area. He specializes in treating tick-borne infections, chronic viral infections, mold illness, and other conditions associated with complex chronic illnesses such as mast cell activation disorder, and myalgic encephalomyelitis chronic fatigue syndrome. That's a tongue twister. His approach to treating chronic illness is to identify all underlying causes of symptoms to provide a clear direction for treatment. With over 10 years of experience treating Lyme disease and other complex chronic illnesses, he realizes each patient is unique and requires an individualized treatment strategy. So welcome, Dr. Maderis.
Thank you for having me.
Thank you for being here. I have so many questions for you, and it seems like a lot of us in the community have a lot of the similar underlying symptoms and causes in conjunction with Lyme disease. So I want to kind of just sort of dissect a lot of things right off the top. And I think probably the biggest overall theme for a lot of people is mast cell activation. And I want to just kind of dial it down a little bit, and I want you to explain it to me from the very sort of the basic what it is so that everybody can understand what it is and what's going on with their body.
Yeah, sure. You know, mast cells are part of our immune system, and they respond to triggers like infections or toxins. And they're there to protect us, really. Most people are familiar with histamine, which is the mediator that's released in response to allergies. Mast cells contain over 100, some people say up to 1,000 different mediators. And so when a mast cell releases it gets stimulated by something or triggered by something, it'll release its contents. And those mediators can go anywhere in the body and trigger a whole myriad of symptoms. So originally, probably like a lot of things, conditions, there's a condition called mastocytosis, which is a kind of a precancerous state where certain cells we produce more mast cells, too many mast cells. And that's a pretty rare disorder, but that was what was originally recognized in conventional medicine. And then you know, kind of somewhere in between is this mast cell activation syndrome. You know, as some people say, it's mastocytosis is the tip of the iceberg, and mast cell activation syndrome is everything under the water. So when we, because these mediators can go anywhere in the body and trigger any symptom, rarely do physicians recognize that could be an underlying cause. People in the chronic illness world are aware of mast cell activation syndrome now. So they might request a test, or start on treatment by themselves. Testing is not perfect, unfortunately. There's about a half dozen mediators that can be tested in the blood and in the urine. But the challenge typically is how the samples are handled. They have to be chilled or frozen right away. And if the phlebotomist is busy and puts the blood in a rack and doesn't put them in the refrigerator right away, then you lose the mediator that we're trying to test for. So testing, I often say, if we get one out of the half dozen mediators back that's positive, it's a home run. And if we get two or more, it's like a grand slam. But clinically, you can also make the diagnosis. Sometimes patients you can scratch your forearm. the lighter side of your forearm here and look for a red reaction, which is called dermatographia. People that get flush, there's some common and obvious symptoms that can happen. And then, of course, with treatment, if symptoms do improve with mast cell stabilizers or antihistamines, that would also suggest we're on the right track. So that's kind of a high level mast cell activation syndrome. I think, and we'll probably dive into this a little bit more, but for a lot of people, MCAS it's the smoke, and we still need to address the fire. And there are, there are mast cell docs that will, that think that mast cells, they kind of the end of the line. And I tend to think not for most people. I think there's a cause to every effect. And that's what's fun about, diving deep into this stuff.
So for everyone out there, what test would they ask for from their doctor?
Yeah, you can request a series of tests. So Quest can do most of them. I prefer using Quest Labs for them. We test histamine in the blood and histamine in the urine, usually a 24-hour urine collection. I send my patients home with a 24-hour urine container. I have them keep it in the refrigerator the whole time. I inform them to take it to Quest in a cooler, walk in the door in a cooler, so that the phlebotomist is well aware that it needs to stay chilled. And there's other mediators in the urine as well, including prostaglandin and leukotriene, and we also get heparin in the blood and something called chromogranin A. I believe there's a handout on my website that people can print to take to their doctor. And I also, it might include the instructions for handling those samples. We print that handout here for our patients. And so they take it with their lab or their Quest order form and give it to the phlebotomist. So the phlebotomist is well aware that the blood and the urine needs to be chilled right away. So patients can go on there, or people can go on to the site and print it if they'd like.
So I hope I'm right in assuming this, but I have heard of somebody that has passed away from MCAS and was hospitalized and couldn't even take water at a certain point. But then certain times I can be highly, highly sensitive in my own home to chemicals, detergents, things of that nature. And it can trigger a pretty severe reaction for me, or even insect bites for that matter. I've grown more and more reactive to insect bites. Yeah. So is it right to assume that there are different levels of MCAS and that it can look so different for many people, or is there actually a marker that says you have it and it's only saved for the really severe cases?
Yeah, well, to your point, there can be severities of reactions, and for example, different triggers will elicit a different mediator to be released from the mast cells. So, for example, stress can, with stress hormone called corticotropin releasing hormone, will trigger mast cells to release a mediator called VEGF, and different mediators will trigger different. Different triggers will trigger different mediators. So the reactions can look different depending on the exposure. And as in time, people's mast cell response can elevate. It tends to compound over time. And that may be for a variety of reasons. It may be that someone still has what I would call a burden, a total burden in their bucket that's triggering that reaction. Well, if you keep adding to that bucket, then people become more and more sensitive to exposures. So everyone is different. Genetically, we're different. Triggers are different. There's different mediators that get released that would elicit different responses or symptoms. There are a whole variety of things. Like anaphylaxis is when someone has that extreme reaction to a medication or some other trigger. As people say, that's like a mast cell hand grenade going off. The whole mast cell itself explodes, releases all mediators, whereas something else like pollen in the springtime may just trigger a histamine reaction that manifests as a runny nose or watery eyes.
Okay, got it. And so let's talk about Lyme disease with regard to this. In your experience, is the MCAS the which came first, the chicken or the egg? Is it that our bodies are kind of worn down initially anyway, and then we get this terrible tick bite? Or is it the other way around? We get the tick bite, and then subsequently our body is then susceptible moving from that point forward to a lot of different things.
Yeah, it's hard to tease out those two. I mean, I am more of the mindset that the infection, it's usually bugs and toxins that drive. We can, distill it down to bugs and toxins that will drive a mast cell response. Could someone have pre-existing mast cell prior to getting a tick bite? Absolutely. And that might make their symptoms more, profound, which in turn may lead them to a diagnosis sooner. Genetically, we're going to respond a little bit differently. If we already have mast cells, the immune system would respond differently. So there, most of the time, I think the sequence of events is the exposure, whether it's infectious or toxic, that triggers the mast cell reaction. There's some, I think, more discussion happening. I just heard a mast cell presentation at a Lyme conference, and the presenter her stance was that is Lyme disease really just a mast cell disorder? And I could see the angle that she's speaking from, because the symptoms that we experience with tick-borne infections is immune mediated, right? Like most of the symptoms that people experience are from the immune system's response to the bug. And so her point was, this is a mast cell disorder that was triggered maybe by an infection. I still think you need to remove the infection. That would be the fire, and the mast cell would be more of the smoke.
Right. And as we all know, getting rid of probably either one of those it presents its own set of challenges.
Yeah.
In your opinion, is the mast cell disorder something that can be reversed? In other words, I know that Lyme disease, we do so much work on reversing our symptoms and getting as close to normal as possible, especially those with chronic or long-term Lyme disease. But can you do the same with mast cell, or is it something that will always be part of your life? What is your opinion on that?
I believe people can improve or heal from mast cell activation syndrome, especially if underlying root cause is addressed, because that reduces the burden that's on the immune system that's triggering the mast cell reaction. Easier said than done, but at the end of the day, it is that total load, and really, as you mentioned in my bio, the whole goal is to identify all the underlying causes. If you find one, and say someone does have a diagnosis of Lyme, but maybe maybe their Bartonella test wasn't sufficient or adequate enough that picked up Bartonella, or maybe they have something like Babesia oticoile that can't be tested that well at this point. They could have other underlying infections or toxins that are contributing to that. They could address their, say, Lyme, but still continue to have symptoms because these other issues haven't been addressed. So but people really can recover and heal from mast cell activation syndrome. They might need to be aware of consuming high histamine foods. They may need to always be on some basic mast cell stabilization support. We have bacteria in our gut that produce histamine, so sometimes correcting digestive dysfunction can improve mast cell outcomes. I think that's where we start to see the details, is when we can look at the whole picture and really tease out what's still driving what.
Mm-hmm. So I'd like to talk about some treatments for mast cell. And I know that it's hard to, again, separate it from the Lyme disease, but are there more extensive treatments in your practice that you will offer someone with mast cell, or is it pretty much lifestyle changes and at-home remedies?
Yeah, well, there's a lot of different approaches to treating mast cell, and everyone's a little bit different. So sometimes, patients will have to trial through different therapies, whether it's supplements or medications, or even, diet and lifestyle, right? If someone talking to a patient yesterday and he was eating sauerkraut every night for the probiotics in fermented food, and which was a great idea, but little did he realize that sauerkraut is very high in histamine. And then it turns out he was having smoothies with peanut butter in them every morning too, and peanuts are high in histamine. So the point is there's a lot that can go into it, starting with the diet. I think I usually inform or at least educate patients where they can find out more information about foods that are high in histamine, if they could start there by avoiding high histamine foods or histamine liberating foods. That's a good starting point. And then they might engage in a mast cell stabilizing treatment, something like, quercetin is a common supplement that people take, and that stabilizes mast cells. Many times people end up on antihistamines like Claritin, Allegra, Zyrtec. Those are called H1 blockers. And then you have H2 blockers, which are medications more for heartburn. That would be like Pepcid, Tagamet, Zantac. And so then you start blocking histamine receptors. There's prescription medications like cromolyn that you might have heard of. Cromolyn works really well for a lot of mast cell patients. There's a medication called ketotifen that needs to be compounded. It's not available orally in the United States, but that works well. And I think it tends to work really well for people that have digestive issues related to mast cell. The mast cells, I didn't mention this in my opening comment, but mast cells sort of reside in the interfaces in our body where we interface with the outside world. So they're in our skin, in high concentrations, in our lungs, in our GI tract. And so a lot of digestive disorders, functional digestive issues, can be related to this, an exaggerated immune response in the gut. Someone could have SIBO, and the bacteria in the gut is triggering a mast cell type of response. Mast cells, when they release their mediators, create more inflammation. So there's a sequence of events that can happen in the gut, like where if someone has high bacterial content, so we call it intestinal, either it's bacterial, fungal dysbiosis in the gut, that causes mast cells to traffic to the GI tract in response to these pathogens. The mast cells then release their contents, creates inflammation, and then that can cause leaky gut syndrome. So you have this whole sequence of events. The end of the line is this gut inflammation. And what I often say about leaky gut is it has less to do with the gut, yet the origin is in the gut, but it really causes systemic symptoms. So it causes things like headaches and brain fog and joint aches and pains and fatigue. We know that histamine, when it gets released in the brain, can cause a leaky blood-brain barrier. So there's a saying, leaky gut, leaky brain. Well, that is what leads to brain fog in people. There's been some great research on the association of Mast Cell Activation Syndrome and brain fog, and also autism and kind of more central neurological disorders. So, again, with treatment, it comes down to what's triggering the mast cell. And sometimes it's more about removing something than actually adding something. For example, I'm treating someone right now who has, you mentioned earlier death with mast cell, and I don't know of that. I've never heard of anyone passing from mast cell, but people can become really reactive to foods. I have a patient right now who can't take in anything orally, so she can't take in food, medications, and so she has a feeding tube. And she happens to test positive for tick-borne infections. She, I think, has a history of mold, and she also has very high heavy metals. And, instead of trying to find the right mast cell combination of therapies, reducing her burden. So in this case, her metals are so severe that I think it's really triggering this immune response. And we kind of know that that heavy metals can drive what's called a Th2 immune response. Th2 produces more what are known as IgE antibodies, and those IgE antibodies bind to mast cells. So again, one of these sequence of events that's triggered by in this case, a toxin. And then ultimately, for her to recover and get better, it's not going to be about taking more antihistamines. It's going to be about removing the underlying cause.
Yeah. Oh, wow. That's a long road. And that's a tough one on top of having tick-borne illness as well. So I wish her the best. She's in the best of hands for sure.
She has a whole team. I'm just one of about a half dozen doctors, and she's and it's been a long road already. But I'm confident she's going to improve as we remove, the offending triggers to her immune system.
Yeah, before I contracted Lyme disease, I'm not allergic to anything. I've never had an allergy my whole life. But then, once I was on my journey, of course, I was really susceptible to mold and susceptible to just getting a huge reaction to that would last, months at its worst. But anyway, now I'm just to the point where if I'm in a dusty environment and I'm kind of finding myself like irritated by the dust, and then I take just a Claritin or something like that, all of a sudden sometimes my joint pain disappears. And I started realizing, wow, this could be all histamine reactive right now. And it was kind of a nice little realization for me that some symptoms can be sort of monitored by something simple at home that I had never associated with joint pain.
Yeah.
Another thing I want to talk about with you is chronic EBV. We all know that, actually, first of all, I'll back up. It seems to me that a lot of people with Lyme disease had mononucleosis at some point in their lives. Not all of them, obviously, but it just seems to be a common theme. Myself being one of them. And then after the diagnosis of Lyme, a year later, I had the diagnosis of a chronic condition of EBV. And my doctor actually did some extensive blood work and found that I was just not getting a handle on that. What is the connection between the two, in your opinion?
Yeah, well, 90% of people are exposed to EBV in childhood. So most people do have an exposure. It doesn't necessarily turn into the full-blown mono that someone is in bed and sick with for 30 days. But these viral infections are not uncommon, and it's easy to have an exposure. We then, of course, mount this antibody response. And for a lot of people, when you test them, their IgG antibodies are going to be elevated. And that reflects a past exposure at some point in time. There is a belief by some people that if the IgG titer is high enough, if it's say 4-fold higher than the normal range, that would indicate a reactivated infection. We tend to think of a positive IgM viral titer as definitely diagnostic of a current infection, and definitely I would say warrants treatment. But the IgG titer that 9 out of 10 of us have, kind of makes it difficult to make an accurate diagnosis. One of the labs we use for tick-borne infection testing, also it's a T cell test. They also test for viruses, and so I test a lot of my patients for EBV and CMV and HHV6 with a T cell test. And, theoretically, if a T cell test is positive, then that indicates an active infection. And, for some of my patients that maybe I'd been treating for Lyme for a period of time, and, maybe their health got better from the variety of things that we did, not just killing the Lyme itself, but maybe immune regulation. And, but when we picked up a positive viral T cell test and I put them on antivirals, it really improved their health. And so I think there's something to be said for the viruses. Are they tick transmitted? Not typically. Potentially some of them could be, but the theory is that they're not. But again, it goes back to that total load. And eventually, as the body is always trying to balance itself out, if there's enough insults, then that's when people develop symptoms or conditions. And so it's part of the picture. It can be for some people. It's one of the underlying causes. If it's there, I think when, especially if it's active, it can be determined an active infection. People can really respond favorably to antiviral treatment.
Mm-hmm. That's so good to know. I never got that far in my journey, but I know that those are an option. And do people typically have to be on them long term, or can they come off?
Yeah, they not ongoingly, but they would be treated for a period of time, whether it's 6 months or so. I think in the flip side of an EBV diagnosis is a lot of people with Lyme, especially out here on the West Coast where you and I are, a child ends up at their pediatrician's office and with symptoms, and the pediatrician runs an Epstein-Barr test and says, aha, we figured it out. You have EBV. Diagnosis made on an IgG titer, but never gets tested for Lyme. And is it truly EBV because they have an elevated IgG titer, or could there be something else going on? Mm-hmm. So I think at the end of the day, all good, the first hurdle in getting anyone with a chronic illness better is to identify all the underlying causes, right? That's ultimately I've just seen too many people over the years with been sick way too long that something was missing from their picture. And when you can discover that and then have a real clear treatment strategy, that's different than, as they say, throwing spaghetti at the wall and hoping it sticks. I'll try this herb because it works, or do this protocol because it's a protocol that's out there that someone's friend's cousin had success with. Everyone is different, and it's really nice to have a clear roadmap.
You talked a little bit about this a couple of weeks ago. There was a recent report that came out about Lyme disease patients and hypercoagulation. And I was really interested in that. I'm just wondering what your take is on it, and what do you make of the findings?
Well, hypercoagulation is, it's for the listeners, it's an increase in blood clot formation in the body that leads to thick blood. And as the saying goes, thick blood is not good blood. Our blood needs to be thin to pass through capillaries. Blood is what delivers oxygen and nutrients and hormones and to cells, and then removes waste products from cells. So when the blood becomes thick and clotty or hypercoagulable, it can, contributes to symptoms. The symptoms can range from fatigue to brain fog to headaches, joint aches and pains. Sometimes we see some specific symptoms like pain in the teeth. But they're, once again, like mast cell, sort of a response to something underlying, like a chronic infection, bacterial or viral, or a toxin exposure, a variety of things. And it's there's been some physicians in the Lyme world speaking about hypercoagulation for a period of time, and I think more and more physicians are understanding it and realizing it, and now testing patients for it. And I think for a long time in my practice, it was something I wasn't aware of, and I've do it more and more now, and it really can help improve someone's outcome when it's treated. So oftentimes we use fibrinolytic enzymes to thin the blood, break down the fibrin inside of blood that makes it thick and clotty. And that way, medications actually work better. They get delivered to the tissues, improves symptoms for patients. Some of these fibrinolytic enzymes break down biofilms, and so we might see some improvement there. But at the end of the day, if you can get the blood healthy, then it definitely improves symptoms, but it also improves the outcome of the bigger picture treatment.
Mhm.
We do a therapy in my office called ozone, a 10-pass ozone, where blood comes out of the patient, goes into a glass bottle that's 200 milliliters in size. And so, we get to see patients' blood, especially when they're first starting treatment. And I'd say the health of the blood directly correlates with how sick the patient is. So when the blood is, thick and dark and clotty, we say it's like a Cabernet, it's unhealthy. And then as treatment goes on, we can see the blood in this glass bottle get lighter and thinner and more like a Syrah. So it's the improvement in health will show up in the blood, but also treating the blood helps improve the outcome.
So it's really, I'm still confused why the blood would become thickened just because somebody has something like Lyme disease.
It's an inflammatory response. So the blood, the cytokines that get driven by infections that create inflammation in the body will contribute to blood clot formation. There's a safety mechanism involved with clotting. There's a whole clotting cascade, and part of it, the tricky thing about blood is, it can't clot too readily. We need it to keep circulating in our body, but then when we cut our finger, we need it to clot up right away. And so there's checks and balances along the way that keep the blood working properly. But it's these inflammatory cytokines that will drive the clotting cascade to increase, and then the blood becomes thick and clotty. It may be a way that minimizes the dissemination of infections in the body, too, right there. The body senses a threat, increases cytokines and inflammation, which in turn, causes the blood to be thick.
Yeah. Interesting. I found that really fascinating. It just seemed like a lot of times, yeah. And actually the article is through your Instagram account. That's how I went to your bio or something, and I found that in case anybody wants to read more about this, it just was a fascinating article, and there were actual tests that you could get if you suspect this, and
Right.
and medication as well, I think, too.
It's probably on my website. Yeah, I don't know of a recent article associating Lyme with hypercoagulation, but I've written an article about hypercoagulation and Lyme.
Mhm.
And I do reference, there's one study that showed that people that had Lyme they're one of the clotting markers was like 67% higher than the general population. So there is a correlation within any infection, for that matter. Viral and bacterial infections will drive that response.
So the ozone therapy will alleviate that symptom. Will the blood eventually, after X amount of times of getting ozone, will it then get rejuvenated and start back and being a little bit healthier, or will it continue? Will you have to continue to keep, tabs on it?
Yeah, so ozone, there's a couple different mechanisms that ozone has on chronic infections. So it can be directly antiviral, antibacterial, kill infections. It can also decrease inflammation in the body. And so the ozone it is reducing inflammation, and so it does reduce the coagulation. But we just happen to be able to observe it because it's in this glass bottle. It's not what we're shooting for when we do ozone, but it's a result of the patient getting healthier for a variety of reasons. It'll manifest in the blood.
Mm-hmm. And so it's a way to somewhat really reverse this, or is it?
Well, it's one of those things, like rarely do we get to see inside of our body or see our own blood, right? Like how do we get to see 200 milliliters of blood? Rarely. People go to get drawn sometimes at a draw center, and I'll hear from patients, they'll say, yeah, the blood was coming out really slow, or the phlebotomist commented how thick my blood was. And, so that's the result of the inflammation in the body.
Yeah. I had a very small procedure done not long ago, and that was the doctor's comment actually for me. It's like, there was no blood.
Yeah.
I was like, well, okay. So who knows? But I've always been, I feel like ozone would be available to and helpful to people with many different symptoms and many different phases of their healing journey. And I've only heard positive things about it.
Yeah. It works really well for some people.
Yeah. Well, thank you for your time. I greatly appreciate it. I want to, if you wouldn't mind, just let everybody know how they can get in touch with you. I assume you're doing some virtual consultations.
I do see patients that are located in California virtually, or people can travel to California. And I like to write and share information. So people can go to my website, which is dr.todd.com, and they can read articles I've written. I love being able to kind of synthesize the scientific information and apply it to chronic illness and put it out to patients so they can understand what's going on. So I like to share through my writing. And then on Instagram, we post a lot of current research that comes out. I think it's a fun way to stay up on the research that comes out with chronic illness, and then be able to share it with patients. I mean, we're I'm in the San Francisco Bay Area, and you're in Los Angeles. People have pretty good access to care, although as we discussed before we came on, there's still a lot of conventional medicine doesn't believe we have Lyme disease on the West Coast. But a lot of people are in the Midwest. You probably get people that reach out to you that they can't find access to care. And so through sharing information, writing, etc., it helps people to be informed, and then they can, it helps them navigate their illness. And there's a lot, there's a long way to go in the chronic complex, or we like to say complex chronic illness world. I don't think conventional medicine, at least in its current model, is ever going to be able to address chronic illness, because they don't spend enough time with patients, and insurance doesn't allow for that time. And we have to look at the whole person and not just look at the parts, right? joke. It's like if you have digestive issue, you see the digestive person, and you see you have an elbow issue, you see the elbow doctor, and things can be interrelated, and really have to look at the whole person. So
Absolutely. Well, I love reading everything that you post on Instagram and the articles. And I guess I'm a great reader. I love really understanding what the heck is going on with my body, and new findings, new research. You're just a wealth of information. I really thank you for helping this community in particular. And I hope that you come back and visit us again. And just thank you for coming.
absolutely. Thank you for having me.
Okay. Bye.
Bye. Thank you.